Well, hello. This is Dr. Isabelle Amigues, and welcome to the Unabridged MD podcast. Here we explore inspiring stories, practical tools, and expert insights for living a healthy life. Whether you're a patient, a healthcare professional, or simply curious about healing, you are in the right place. And as always, if you are looking for something that's so much bigger than just a rheumatology practice, please come check Unabridged MD, as we are the right place to get you to remission with the least amount of medication. With that said, let's dive in. All right. Well, welcome. Thank you so much for being here. So Morgan, you have quite a story of hope. And you know, we love those stories.
Yeah.
So I would love for you to tell us your story, and as little or as many details that you want to share. But I think most importantly, because what we're sharing here is the hope that there is in rheumatology, is how you felt when your medical issues, symptoms started.
Yeah. So I kind of all started after my first baby. I had thyroiditis afterwards, and I was pretty sick for about 10 months, which is a long time when you have a newborn. But around that 10-month mark, I did start to feel a little bit better on the medication. And so it wasn't really until after my second baby, which was in July 2024, where I got quite a bit sicker. And I did have thyroiditis again, which was hard and unfortunate. But I realized there's something more going on. And from that point in my journey, from when I realized that I probably had arthritis to the point where I was able to get help for it, it was almost a year after my baby had been born. And it was a really, really hard, long year. Yeah.
And so what were your symptoms? Like, what was happening? And how, so are you saying that because you had just had a baby, you basically thought, oh, this is normal?
So initially, after my first baby, I kind of did. And so I waited a long time to get treated for thyroiditis until it was like I couldn't ignore it anymore. The second time I was like, I again dismissed it, but that time I dismissed it thinking, oh, it's just thyroid issues again. And we know there's kind of nothing we can do except for wait until you burn out and start a medication and then go from there. So yeah, I think I did. There was a lot of self-doubt. And initially when I took my symptoms to a provider, there was a lot of doubt too, because my labs were normal. My exam was pretty good. But I was struggling, not just with daily joint pain and stiffness, but also I had GI symptoms. I had weight loss to the point where I was almost underweight, but less than I weighed in high school, really not feeling well. I had cardiac symptoms, actually. I was having lightheadedness, shortness of breath, palpitations, chest pain, all things that I knew weren't normal because of my background in pediatric cardiology. And probably the worst part of it all was the fatigue and malaise. And when I say fatigue, I don't just mean being tired, but it felt like having a flu every single day. And I had this feeling every day where it was like fighting gravity to get out of bed. And I had to do that. And then I had to get up and engage with my kids and take care of them. And it was a struggle even to walk to the park. And at the point that I finally came to you, it had been almost a year. And I just felt like I had missed most of the first year of my baby's life. I mean, you don't realize how much energy it takes just to be present and engaged until you don't have it anymore. Yeah.
Absolutely.
Yeah.
I as a mom also, I relate. I feel like we don't realize, I don't think people who are not parents realize the amount of energy having your kids take. What's really interesting, and you're a healthcare, worker, and you're, as you said, in pediatric cardiology, so you work really hard, and it's almost like, and then you're a mom, and so then you're like, oh, this is normal, or I should not complain.
Yeah,
this is okay, and then you move on, And then you're looking back and you're like, wait, why did I do that?
Yeah.
Why did I accept this?
Yeah. And postpartum is hard.
Mhm.
And like postpartum depression is very serious, and anxiety. And those are important issues to recognize and treat. But I think we also have to be able to, as providers, recognize when there's something more going on, and
Yeah.
be careful that we don't just dismiss that, and that we really listen to the patient.
Yeah,
Yeah.
no, that's totally. And so what made you decide, okay, this is not just thyroid, something else is going on? Like, was there like some sort of intuition? What made you think, okay, I need help, like,
Yeah.
and it's not just thyroid?
I think that I started having daily low-grade fevers, and I knew that that was not normal. And so in all of this, I think I told my husband several times, like, am I just going crazy? Is this all in my head? And he said, well, maybe, but going crazy doesn't cause fevers.
I love that.
Yeah. So that was the point at which I was like, okay, no, I really need to seek help. And when it was to the point where we had a nanny coming multiple times a week because I couldn't get out of bed and be a mom almost a year postpartum, that was the point at which I was like, okay, I need to get a second opinion. Yeah.
Mhm.
Yeah.
So then what made you, like, tell us the journey and maybe how you felt when you came to the practice.
Oh, I was terrified. I was scared that you were going to tell me that you just couldn't help me. Either maybe you wouldn't know what was going on, or you were just going to say the same thing my last kind of providers had said, which is, I'm sorry, we just can't really do anything more. You're not sick enough. And so you just have to live like this.
Okay. So that didn't happen, right?
No, that did not happen.
So what happened?
Yeah, it was a very different experience from the beginning. I could tell, like, from everyone who I interacted with in your office, that everyone had the time and they cared. When I came in and I told you my story, and I think I just like broke down in tears because I was feeling scared and pretty hopeless at that point. You listened to my story. You didn't just look at my labs or my exam. You listened to me and you said, that is not acceptable, and we can get you better. I know what is going on with you. So we're going to do some imaging. We're going to get you on a drug that's going to work. And I don't want you to settle for this. And I don't want you to settle for 80%. I want you to be better.
Mm-hmm.
Yeah. And so I left your office smiling and feeling hopeful, I think, for honestly the first time in my postpartum year.
Mm-hmm.
Yeah.
And you did share with me recently that you had hope, but you were not sure. You were like, I don't know that I can believe this. Like, what made you doubt and what made you believe?
Well, I think being in healthcare, my mind is trained like to look at the objective data. And also I don't know, when you're spending a lot of money on something, there's always a worry, like, is this going to be worth the investment? Is this person mostly just out to make money? Like, I didn't know you then, no offense,
No,
but I was
that's
just
a valid question.
Yeah, like, even if she can't, is she really going to be able to help me? And is that really what she's here to do? Something that was really reassuring for me was your wealth of incredible reviews, your incredible educational background, and the videos you put out. I could see a lot of compassion in them, and sharing your own personal health journey. So yeah, but there was that seed of doubt, like, what if she's wrong and I'm not going to get better?
Yeah,
so,
no, absolutely.
Yeah.
So then you start treatment. How are you doing?
I'm doing really well. I think I'm like 80%. And like we talked about, we'd love to see 100.
Yeah, I do. We are not setting for 80%.
Yeah. And I love that. And, Yeah, I think, right now
We
I
just
just
started,
have,
yeah.
we just started. I have some mild but totally manageable symptoms. And I went an entire month, for example, like feeling like I had more energy than I had in years.
Yeah.
And I've been able to get out on a bike with my kids on the back, and I'm starting to climb again and like just cook and be engaged with my kids and do everything that brings me joy. So,
I love that.
Yeah.
And so, I want to share this with the auditors because I think we don't think that, I don't know if it's, we don't think that we deserve, like I don't know if that's the exact word. But it's almost like if it were our friends, if it were our kid, we would absolutely get the best for them. But somehow when it comes to us, we're like, no, I'm going to fight through it. It's good. It's okay. Anyway, this is okay. I can live through this. I can live through this. And it's really interesting because I think particularly the healthcare body is incredibly resilient, but to a fault, where it's like, no, you have to say no at one point. So that's what I did. I said no to insurance because I'm like, no, I didn't go through cancer, and now I'm gonna be like, beaten up by the insurance system. I think my patients deserve better, and I deserve better. Yeah. But I had to go through my own health crisis to say, no, I'm done. Right.
Yeah.
So there is that. The other thing is, so this is really important for the auditors. And that's really why I wanted to share your story, is to realize that there is hope. There is, I want to say, in rheumatology, there's almost nothing that we cannot treat. Right. And that we cannot get to full remission. Like, it's very rare, very, very, very rare that we cannot get our patients to remission. It happens like everything, right? And the truth is that I don't want to say that some patients don't want to get into remission, but it's interesting. Sometimes I'll discuss with patients why they have so many side effects to all of their medications. And so I'll ask this question of like, is there any reason that, like, is there anything that you would lose by going into full remission? And the last time that I asked this question, the patient said, oh yeah, there is. Like, actually, this would not make my life better. This would actually make my life much more difficult. But she had not put it together. So suddenly she's realizing that. And I think the next time that I see her, she won't have any side effect because she's able to realize like, oh, there is something that's preventing me from having no side effect from those medications and get to remission, right? So it's this idea that you're stuck with whatever symptoms you have. You don't. No one is stuck with any of those symptoms. And this is something big for me because I don't know that every single doctor shares this. And I do think that we need to, right? Isn't it interesting that in pediatrics, the outcomes are so much better than in adults? And I think it's a mindset. Like, kids think that they are invincible. And they are. They truly are. And I wonder if that's what we're losing as adults, is maybe an idea that maybe we are not invincible and maybe we deserve, I don't know if it's deserve the word, but maybe
Yeah, that's so interesting. And I think that's so important too. And I really hope that anyone who, watches or listens to any of this, that if they're going through a similar journey, that they don't give up hope. And like you were saying, on rare occasions, sometimes doctors can't do everything we want them to do, or they do have to give us hard news. But I don't think anyone should settle for anything less than an amazing quality of life unless they've gotten a second, a third, a fourth opinion, and they have tried everything.
Absolutely.
Because that's your life,
Exactly. I love that. I think that that's, it's really funny. So I do share my story. I had the most incredible oncologist. I'm going to try to get her in this practice because she retired. I'm doing so well that, my oncologist retired, but she was incredible. She met me and she told me 95%. She puts this, on a piece of paper. And I'm like, what is this number? She said, remission rate. I'm like, really? She said, cured rate. And I'm like, in rheumatology, we don't use the word cure. And she's like, I use it. And then she's like, no, this is 95% cured rate. And at the time, I had not had my PET scan. And And she told me later, she was like, it's rare to have metastasis with this type of breast cancer. Well, I was in luck, and again, it taught me so much. I'm actually grateful for the experience and all this, right?
Yeah.
And it was interesting. She never used numbers after we knew that it wasn't just stage 3. So stage 4, metastasis to other, to organs. But what was beautiful is that I kept in my mind this positive, the cure rate. I was like, no, I'm going to be cured. I'm going to be cured. I'm going to be cured. And she never changed my mind about this. I wouldn't share it but it was kind of like this understanding of we're going for cured.
Yeah.
We're going for full remission, cured.
Yeah.
And what's interesting to me, and I don't know if it's America or if it's just the way I've been, trained in France, or if it's just the way I am, it's that sometimes I hear physicians that because they want to share the hard truth, remove all hope. And I understand that there are some, like degenerative neurologic disorder. There are some things that can be really, really tough. But at the same time, I'm like, who are we to remove the hopes of our patients? Like, when really, if you're going to see a physician, that is what you want, basically, right? You want to have the hope that you're deciding, that you're in control of your body, that you're in control of the outcome. You get to decide, right? And so, first of all, in rheumatology, it's incredible the outcomes we get. Right. So, I mean, you're experiencing it yourself right now, and it's pretty fast. And I know that sometimes, like you at the beginning, people are like, really? It's going to be that fast with a biologic? And I'm like, yeah, it is. But sometimes. Yeah. And the truth is this, it's not always that fast. But it's kind of like my oncologist saying the 95% is that in the vast majority of time, this is what I have seen, and those are the data. And so who am I to tell you the negative one? Like, if it's negative, we'll deal with it. Yeah. And this is exactly what she did. And I appreciate it so much for that, because I knew it was serious. I didn't need her to show me all of the negative things. I wanted her to show me the path forward to a positive outcome, to a good outcome. And I think, the more I'm in this practice of rheumatology, the more I'm realizing that it's not just about being a technician. I think AI can do that. It's about making sure that our patients are like understanding what's going on with them, right? Here is what's happening. And then here's where we're going. And here's the path forward. And yes, the biologic work really fast. And if that one doesn't work right away, there will be another one or another one or another one. But we're aiming for the best one, for the first one to working well. And it seemed to me that that's what you understood that day. You were like, oh, that makes sense now.
Yeah, that's so important for patients to understand what's going on with their body and not just be told like, look, this is how it is with no explanation, But I've seen that a lot, it's hard.
You've seen that a lot. What do you mean by that?
Just with, other friends who have gone through health issues and or even some of my own journey. Sometimes you're just kind of told like, look, sorry, I don't know. This is the end, instead of like getting a full explanation. And I think, part of that is the way our healthcare system is and the way hospital systems work. And I mean, patients don't have enough time to really tell their full story, and providers don't have enough time to listen to it all, So,
and at the same time, you know what, it's there's a little piece of me that breaks every time, because I hear this, because it's actually, it saves time in the long term. I saw a patient once that saw 12 other doctors before she came to see me. And she had diabetes. She had type 1 diabetes. I made a diagnosis of type 1 diabetes. I'm a rheumatologist. And why? Because no one put things together, because they just didn't have the time. And probably they were just looking at internet, right? Like not internet, but the medical records to like, you have to do all of those things like reconcile medication, reconcile allergies. And so then at the end, you're like, hey, did you actually talk to the patient? Did they tell you their story? And it was really an interesting thing where I was like, something's off. I don't think this is rheumatologic at all. And then it didn't come to me. The diagnosis didn't come to me right away. It's just, I think I slept on it. And then the next day I called and I was like, and they were like, well, actually, there has been, she's peeing all of the time. And then I was like, wait, is your breathing pattern different? Yes, it is different. Like the parents were, yes, it is different. Mm-hmm. And I'm like, wow, this is polyuria, polydipsia, and tachycardia. I think she's in DK, diabetic ketoacidosis, which is a potential life-threatening complication of diabetes, sent her to the ER on Christmas Eve. They were not happy about that. But I was like, look, this can potentially be very dangerous. And the fellow at the emergency room called me and how did you know? Because I didn't have any labs. How did you know? And I was like, she told me her symptoms.
Wow.
Polyuria, polydipsia, tachycardia. Like this is it, right? And they were blown away. And I was like, well, if we don't listen to our patients, we will not hear that. Mm-hmm. And so it's to me, that's why we think that it saves the system money by seeing patients like super fast. But at the end of the day, if one person had taken the time, we wouldn't have had a need for 15 other people or 12 or I can't remember the number, but it was a lot of people. So yeah.
That's so true. And I like to think that a lot of healthcare providers understand that. But unfortunately, it's not always, that's the wonderful thing about your practice is you kind of get to design it and make it how you want to serve patients. But, other hospitals and things aren't strictly run by physicians and providers.
Not.
And so, so that becomes very difficult then.
Yeah, I think, you're in the healthcare space. I do think that, there is, what's the word? It's almost like we're hurting physicians. So I see, and one of the reasons I want this practice to be successful. And you were saying the whole team really cares because I remind them every week. And I think it's ingrained in them, but I also remind them. I'm like, we're not doing this just for our patients. We're doing it for other patients so that they can see that there is hope. And also, and this is a big value statement for me, we're making a clear statement that another way of practicing medicine is possible for other physicians and nurse practitioners and, physician assistants. So they don't feel like they are stuck in the system they're in. And so, right, like in the previous institution I was at, I remember super clearly that one of the reasons I left is that I was like, whoa, I feel like I'm in France again. I love France, but people working in France, they complain a lot. And so I was like, I don't want to be in this environment because I really like America because I feel like people love what they do. I love that. And I remember I was like, wow, people are really complaining. It's like, I was like, it's reminding me of something. And I was like, oh yeah, it's reminding me of a lot of complaining. And people complain for a reason. It's not that they are complaining for no reason, and I remember, and one of my colleagues was like, let's open a direct care, cash pay practice. And I was like, let's do it. And so I tell this to my colleagues, I'm like, now you get to choose because now you know what's possible. So if you want to stay, you stay, but you're choosing because it's not out of like, there's no other options, right? But yeah, it's, I think the healthcare is hurt. And in a way, because it hurt, we have the ability to open a practice that, is really like, looks like the care I wanted to have. So, yeah.
I hope that your practice inspires a lot of other providers to do the same because I think it's just this kind of care is not accessible in this country. I don't know how it is other places, but not really here. It's accessible to so few patients right now. And I think everyone deserves the kind of care that they can get here.
Absolutely. Yeah. You know what they say? So I was talking with people in France, like when I did my training, there were some older doctors that would complain about, the training. So that was like 20, 25 years ago, maybe 30 actually. No, 25. And they would be like, oh, at our time, we would have no counting on the time that we were spending with patients and all this. And I was like, yeah, well, that's fair. And I do believe that. I fully believe that physicians never really counted their time with patients. What they missed, and I remember talking to them, I said, but did you have the level of paperwork that we have now? And they said, oh, we had no paperwork. That was the nurse that was following us, writing the orders of a dog. So there was like, basically they had a scribe. They had they were writing nothing in the chart. There was no legal, no admin, nothing, right?
Yeah.
And so I think physicians, nurse practitioner, physician assistant, nurses, right? Like everyone at an healthcare, they don't go into the healthcare system for paperwork. Let's be honest, right? If we were to remove the paperwork, we would have so much more. And it would be interesting to see if, because I know like so the people who are using Epic use like, they have an AI that's included in the system. I'm a little bit worried about it because I'm hoping that the trainee particularly, I'm really hoping that they are using their brain, because you need to work your brain and figure out the differential diagnosis and all this. But at least from a note taking, maybe there is, AI that can help with that. And that will help, that hopefully will help as long as we don't squeeze the doctors and, the healthcare worker all the way to the last drop, which it feels like it right now. Yeah. But yeah, it's I don't know that there is one system that's better than the other, but what's clear is the outcomes are definitely different.
Yeah, we do, like, providers do spend so much of their time charting and so little with the patient, the way our system is now. And it's really unfortunate.
Is there, like, if you were to look at you at the beginning of the journey, so maybe early on beginning, when you had the thyroiditis, I cannot say it, the thyroid inflammation, when you had that, and then you started developing some joint pain. Is there anything that you would tell your younger self at that time?
I think I would tell myself to not give up hope and to not settle, like I was saying earlier, for anything less than a good quality of life. And I wish, like, one thing that I've really learned along this whole journey is how valuable my energy is. And I didn't realize that before, so now I'm much more careful about how I spend my energy. I just have a little bit more give and take, I guess, and flexibility with things, that if something is really draining, I let it go, and I bring things closer to me that bring me joy. And, I still am very passionate about doing things to make a difference in healthcare and the world, but I recognize that as one person, I need to let myself do what I can in my space and not try and take on the whole world's problems. You know what I mean? So if I could go back and give myself that mindset from the beginning of the journey, I think I would have been better off.
I love this. Yeah. You know what I love is hearing this, which is you're not, so when you have, I don't like the word hit, but when something like this happens, when there's a crisis, we're going to call it a crisis. There's a medical crisis, right? That's a personal medical crisis. Very often what a physician may feel is that, oh, they want to be back where they were. I think that, and this is where it's beautiful, you don't want to be back where you were. You want to go forward and upward. And when I'm hearing you, this is exactly what I'm hearing, is this has taught me so much.
Yeah, definitely. And another huge thing, and I think it shows through for you and your journey as well, is I think, it's not that I didn't care. Of course I cared as a provider before, but the level of compassion and understanding that I have for patients now is just greater. And there's just no other way, I think, sometimes to learn that than to go through the hardship yourself, So I am grateful for it. And I feel like I'm in a better spot now, even being 80% than I was before all of this started.
Yeah.
Yeah.
I love it. So what are you looking forward to?
What am I looking forward to? I'm looking forward to climbing very much.
I
I haven't done that since before my first baby was born. I don't even know. I'm just looking forward to traveling again and being able to like reconnect with my friends and family more and watch my kids grow and be there for all of it.
I love it. I love it. And you can have it all. You can have it all. There's no reason not to. I love it. And I think the rock climbing is a big one. Yeah. As a rock climber myself, completely get it. So yeah.
I didn't know you climbed.
Oh man, I'm terrible, but I love it.
Same.
I'm horrible.
Oh,
I'm horrible. I did it all through chemo, and like the first chemo I had, I went climbing, and I was on the wall, and I was like, "What? I'm not dead today." And I remember like what a powerful move of like rock climbing an overhang wall, in addition. And I was like, I'm not dead today. I'm not dead today. No, this is huge. And it's almost like you're looking at something that has no gravity. You're like defying gravity.
Yeah.
So in a way you're defying, it's almost like a little bit death defying.
Yeah.
Right. And so it's going to be super, super good because we're like, yep, I'm here. And I have a bunch of my patients who are rock climbers. So this is a good thing. It's actually great. So I'm very excited for you. Morgan, thank you so much for sharing your journey. I know it's very vulnerable to share, where you were and where you are now and where you're going. And thank you. I think this will reach someone that needs to hear this. I think that's important. To me, that's important. That's the hope driven by science, right? There's science. There's nothing woo-woo in what we did. Guys, any rheumatologist could do this. Let's be honest. Any rheumatologist. But we have to listen. We have to listen. We have to work with our patients. And this is exactly where we are. And we have to have our patients, like you, understand where you're going so that you're like, oh yeah, this is the treatment I want. Oh yeah, this is where I'm going. Yeah. So this is good. This is good. So thank you.
Absolutely. Well, thank you for getting me better so that I could be here for this.
Yes. And rock climbing.
Yes. And rock climbing.
Thank you again. So and everyone, if you're listening and you thought that this episode was something that's brought to you something, or if you think that someone could benefit from listening to Morgan's story, please share it. Especially in the world right now, we need to share stories of hope. So share it with a friend or two. And thank you for listening. Thank you. Well, thanks again for tuning into the Unabridged MD podcast. Be sure to subscribe so you can be notified when the next episode is up. And as always, if you think that this would be helpful for a friend or a family member, please share. Wishing you wellness. Until next time, take care.